Hi. So sorry it's been so long since I've done a blog. I think what with people being on holiday and various busyness, it has just slipped off the agenda, which isn't too good. So lovely to be talking to you all again. Mass is happening, and I'm sure you've seen some of the work that the RCM's been doing in your reading of the press. This week alone we've seen the launch of the intercollegiate FGM guidelines, which really the RCM played an absolute key part in getting together. My thanks to Janet File for that. These are incredibly important guidelines which for the first time come right out and say FGM is a form of child abuse and there should be no excuse for treating one girl differently to another just because of her cultural background. And I think this is really important. One of the things that struck me very forcibly at the launch of these guidelines was the fact that people have been talking about how do we eliminate this barbaric practice for at least 20 years, if not longer. And I really hope that it's now time that we stop talking and see some real action in preventing a practice which, as I've said, is barbaric and which causes women physical and mental distress for the rest of their lives. So an important landmark. And then today my activities are absolutely full of discussions about perinatal mental health. I've just been at a round table about that held by The Guardian, and this afternoon I'm going to the all-party parliamentary group. And in the last few months there have been numerous reports produced by the NSPCC, the Mental Health Alliance, and various other bodies working in this field, saying it is absolutely ludicrous that we have a condition that affects 10% of the pregnant population, and yet we're not putting the services in place that we know we need if we're going to give women the support they need, both in terms of preventing problems occurring and in terms of treating problems when things get really bad. I'm certainly making the point when we discuss perinatal mental health issues that this is an area where I firmly believe if we had more continuity of care in the antenatal period, if midwives had time to build relationships with women, we would be able to make a significant difference. And therefore, having the right number of midwives is incredibly important. But of course, we can't just get more midwives, we have to get more midwives who do the right things. So we do need people to really have to be prepared to deliver services that are more personalised and in which there is more continuity of care. So lots of discussions about putting policy into practice. And on that note, I also went to a very interesting seminar recently looking back at the Changing Childbirth report. We had a panel of experts who were involved with preparing that incredibly seminal policy document, but then asking how did that document come into being and has change happened as a result of it. And I think, unfortunately, what we all had to conclude was actually the words have continued, the rhetoric is really good, but maternity services haven't really changed in a way that ensures women get choice, continuity and control. So, you know, the RCM really has to play a very significant part in trying to get the rhetoric into reality. And I just hope that if I am in the midwifery system in another 20 years or even in another 10 years, you know, we're not still talking about things and not doing anything different. On that front, I guess, you know, whenever possible, not only am I talking about the fact that we need to have enough midwives, but I am really pushing the fact that there is now extremely good evidence showing that not only does continuity of carer improve women's satisfaction with services, but it actually leads to women experiencing better outcomes from their care. So in a way, I think the midwifery profession has an ethical duty to develop services that mean that women get to know their midwife and stop saying that they see a different midwife at every antenatal appointment. I hope I'm not ranting on too much. You may think I am, but I do feel very passionately that we've got to see some change. And some of that is down to the policy makers, the funders of maternity services, and some of that is down to us. And if anyone out there who's a member of the Royal College of Midwives wants some help with implementing change in what are incredibly difficult circumstances for you out there practicing at what we suppose we would call the coalface, can you give us a ring at the RCM? We're all available to come out and talk to you, to discuss issues and to discuss how in a very imperfect world we can try and get the best out of our maternity services. Before I go, a couple of things. Really looking forward to seeing everybody at the annual conference in Telford next week. That's going to be a great event and I hope you're coming. And I do know that I'm going to see masses of student midwives, which is fabulous, and I hope there'll be a fair lot of MSWs as well as midwives there too. And finally, thank you to Scotland. It was absolutely lovely coming up to see you on Stornoway and in the Vale of Leven and Inverclyde. Great services you're providing in all of those places. Well done. Bye-bye.